Your baby squeals and squirms in your arms. The Power Ranger's Band-Aid on his arm does nothing to numb the pain. As the nurse prepares to jab your son with another shot in a sterile, windowless room, you regret that you had to come here in the first place. Vaccines have saved millions of lives. To reap the benefits of a united front against infectious disease, all 50 US states require that kids get vaccinated before they attend school. This makes sense. Kids are germy. When you put them all in the same place, disease spreads. Now, vaccines aren't 100% effective, but immunization stymies disease on multiple fronts. In addition to being protected from the likes of measles and whooping cough, an immunized child is also less likely to spread these diseases to kids with allergies or compromised immune systems who can't get vaccinated. In the eyes of state governments, immunization requirements are a form of self-defense. In addition to jeopardizing their own children's health, parents who don't get their kids vaccinated also expose vulnerable children to even greater disease risk. People who spread anti-vax misinformation face ridicule and vitriol. Their conspiracies and junk science spread epidemics. People die from vaccine-preventable diseases. But this fact can be easy to overlook. There haven't been any major vaccine-preventable pandemics in the United States in recent memory. It's easy to dismiss vaccines when you haven't seen family and friends die from polio. It can be cathartic to join the online hordes stampeding parents who spread misinformation, and while this outrage is righteous, there's one problem. It doesn't work. Immunization rates are falling. Measles was eradicated in the United States in 2000 through effective vaccination, but just this year, in areas with low immunization rates, outbreaks have reached over 100 patients in 5 different states. Vaccines can cost hundreds of dollars. Now, most private and public insurance plans will cover most of these costs, and some states have programs to help subsidize vaccine costs. But there are still 30 million people without health insurance in the United States. For families living on the margins, medical bills of tens or hundreds of dollars is more than just pocket change. Now, in the United States, there's a relatively small gap in immunization rates between the rich and poor. Even those without insurance have to send their kids to school. If they don't shoulder vaccine costs, they'll face the social stigma and legal penalties that come with truancy. But it doesn't make sense that the government should have to force people to pay for vaccines. They shouldn't cost a dime. The benefits of vaccination are manyfold. For every dollar spent on vaccinations, $10 to $16 are saved in healthcare costs down the road. And making vaccines free would give healthcare a friendly face. Now, cost is not the sole driver of the anti-vax movement. There are pockets of low immunization in wealthy communities as well. But in diffusing the costs of vaccination to the entire tax base, people would pursue a common goal together, protecting their kids from disease. Now, we could try to bring people into the fold at needlepoint, imposing harsher social, financial, and legal penalties on anti-vax parents. Some states, for example, have restricted or eliminated philosophical and religious exemptions to immunization requirements. And these measures have worked to raise immunization rates. But my fear is that if we only take a punitive approach toward anti-vax parents, we risk alienating them, losing a chance to persuade them and preserve the health of future generations. Punishment is not the only means to achieve public health goals. Making vaccines free would remove a barrier to access. When healthcare feels less like a stick-up and more like a collective force for good, people will be better prepared to reject anti-vax misinformation. Now, it almost goes without saying that a policy with such obvious and universal benefits is not likely to happen in the United States. Pharmaceutical mergers have consolidated vaccine productions. Companies have patented nearly every step of the manufacturing process since the 1990s. And this means that drug companies can use their monopoly power to ratchet up the prices patients pay for vaccines. Now, while rising prices has meant that patients pay more for vaccines, clinics may face an even steeper burden. Many pediatricians lose money with every shot that they administer. If the government steps in to cover vaccine costs, questions still abound. who's to decide the appropriate level of compensation for clinics? With payment guaranteed, what would prevent drug companies from ratcheting up prices even further? And if states are the ones who foot the bills for vaccine costs, would they be incentivized then to omit valuable vaccines from coverage just to save money? In the United States, simple proposed solutions seem to inevitably devolve into shaking fists at a fractured system. It's tough to justify a status quo in which drug companies can extort profits from decades-old innovations. And so while their views are dangerous, I think we should have some empathy for anti-vaxxers because their message isn't entirely wrong. Policies designed to help people are often warped to benefit the rich and powerful. Rather than laying full blame at the feet of anti-vaxxers, I think we should also examine the systems that create consumers for misinformation. When we start to view anti-vaxxers less as antagonists and more as misguided, concerned parents, we can use both the carrot and the needle to bring them back into the fold.